guys are so far. Okay, so my name is Tiina Zilliacus, and Kitty Müller was introduced here that she always is present in every health conference. So I have the same feeling. I'm always facilitating a health-related digital panel at the Upgraded Life and a couple of other events, because I basically find the format of discussion and a little bit spurring the discussion around maybe controversial topics quite interesting. But a few words. Okay, so no, not. Something has happened. Someone is calling. Okay. Yes. Okay. So a few words. I work together with both corporations as well as startups in areas of everyday digital. That means health, food, tech, living, moving around, stuff like that. Together with my partners, we have a small fund or ventures team, and we do sweat equity and equity investments currently, so CherryonTop Accelerator. And in the panel, I thought that we will have a better discussion if we really have some sort of a problem with which we start to kind of look at the therapeutics versus digital therapeutics field. And I thought to choose an angle that currently actually in Finland, the cost of work undone is over 4 billion euros a year for our private sector corporations. So this is like over 6% of the turnover of our private sector companies. And this means that when we have sick leaves, disability pensions, accidents, and occupational healthcare costs, this is the sum that we actually pay in here of people not working, not kind of doing the stuff that actually contributes to the economy. And I think that in our country currently, these types of discussions are kind of hard to have, but very vital also to have. So major contributors to this sum are kind of back and neck problems, mental problems, and at least how employees feel the increasing demands of work. So this is kind of the setting, so to say, that we are spending a lot of money to these types of problems, and then how could we be more efficient? What could we do? Where is the digital the solution versus where is the face-to-face the solution? And that's why I thought that that type of setting would be good for the discussion of how to spur real change than digital versus face-to-face in therapeutics. But first, before we kind of dig deeper into this theme, I would like that our distinguished panelists introduce who you are and kind of how you look into this box and what type of solution you guys are building or bringing to the market. And maybe we start from Kristian and move from there, and let's hear if that works. Or
let's hope so. Hi everybody, my name is Kristian Ranta and I'm the CEO and founder of Meru Health, which is a digital therapeutics solution for depression treatment.
Hi everyone, I'm Kaisla Joutsenniemi. I'm the chief physician at HUS Psychiatry in the department responsible for IT psychiatry and psychosocial treatments.
Hello all, my name is Satu Mäki and I'm the founder of Carelia, which is a marketplace for holistic well-being.
Hello everyone, my name is Jakob. I'm the CEO and co-founder of Arthro, which is a digital therapeutics company for musculoskeletal pain, mainly for osteoarthritis, which is a very common chronic joint disease.
So maybe if you'll tell a little bit first about kind of, how you've gotten into this field and what does your product do, and maybe we do another way around, so then we set the scene kind of for the next question, which is like, where is the digital really the solution and where it's not?
So just like the topic is of this session, it's face-to-face versus a digital context. So the evidence-based treatment that we're running online was originally face-to-face. The science comes from Lund University. So we have a couple of professors and physical therapists on our founding team. So that's actually how it started. We had this, notion of an idea like musculoskeletal pain, it's growing, it's costing more and more, and it's not scalable to bring in every person that has osteoarthritis into the clinic every week. So how could we build a more cost-efficient, scalable solution? And then we came up with we didn't originally come up with the idea of digital therapeutics, but we saw a lot of exciting stuff happening in that area. So we took the whole treatment and then we put it in a digital context. So that's a little bit of the background and how we started.
Thanks.
Okay, and the story behind Carelia, the marketplace for holistic well-being, is that the problem in the market is that the consumer has no way of seeing the whole entity of well-being services in the market. It's really hard to have the full view. So Carelia combines both traditional medicine and alternative treatments to kind of form this full view so that the customer is able to compare, buy, and review different kind of treatments.
Thanks.
In HUS psychiatry, we see that there was a need to provide fast, easily accessible psychotherapies for patients with depressive symptoms, anxiety symptoms. And we realized, even though we have Kela, the National Social Care Institution, who provides rehabilitation, but we don't have the acute care available for everyone. So we wanted to create web-based solutions that would be available for not only patients in the HUS area, but also in all of Finland. So what we have created now actually is a national service so that anyone up to Lapland can buy a therapy for depression, for anxiety disorders, for a bipolar disorder, combining both digital and live components. But we'll get more into that later on.
Yeah, so we started from a place like having built digital therapeutics or like digital health companies before, where we learned certain components that, you know, what creates engagement, and engagement is a key point for any kind of any behavior change and you know, curing any kind of behavioral problems. And you know, that's kind of like some of the past, and then we've applied a lot of the learnings from our past, from our previous companies, to Meru Health, and why we are kind of building a digital solution is basically coming from also a couple of validated therapies that, like Jakob's saying, basically like stuff that's been validated, like, you know, cognitive behavioral therapy, behavioral activation, or mindfulness therapies that have been validated in independent research trials and have been used widely in the, you know, Europe and US, in sort of like face-to-face setting mainly. And then we're kind of, you know, taking things into the mobile format and making them very highly engaging.
Okay, so I think the billion-dollar question always when we talk about the digital solutions is that where do you think that, you know, really the digital interaction and the digital solution is at its best? So we're talking about web and mobile interfaces and the problems that you guys solve. And where do you think that real face-to-face interaction is needed, you know, together with patients? So, you know, just some maybe concrete examples based on your experience and stuff like that. And maybe we now go from Kristian onwards.
Well, yeah, that's a good question. I'm not maybe the best person to even answer that, because I think you might be better based on your experience. But I'm kind of, what I see is that that there's definitely like certain populations where the adherence to digital solutions, like what we're now building, we're in closed beta, so we're sort of like running a closed pilot at the moment. We're seeing adherence rates that are like far beyond anything else on the market now, and far beyond anything like what the physical setting can offer today. But the point is that it's not for everyone. So, you know, I'm not maybe the best person to kind of directly answer your question, and I'd be happy to hand it over to you.
Thank you. Okay. Yeah, so my background is I'm a psychiatrist and a cognitive psychotherapist. And first here, I think we need to set the scene on what do we refer to when we speak of digital, because we have face-to-face encounters, and then we can have sort of video conferencing sessions where it's a live session where you talk, and then there are sessions where you chat, for example. That's also live. But then what happens can be not real time, so that you write a question to your therapist and he or she answers a couple of days later. Or there are digital components involving videos in our programs you can watch. There are exercises you do on your own time. And there's more and more research that the difference between face-to-face and sort of through a video technique, the effectiveness of the psychotherapies, there's really small difference, if at all. So I think really, whether we call that digital or not, I think is irrelevant. I think here the digital refers to the other added tools that you have, exercises, exposure to different kinds of, if you have a phobia, exposure to those environments through videos, all those extra tools. So if the question here is when do you actually need the added impact of, what was it, face-to-face, then I think it's either face-to-face live or face-to-face through a video. And here I agree with Kristian that it's patients who need extra motivation for some reason, or they have cognitive deficiencies, problems with memory or focusing or whatever. Those are two groups. Or patient who start off by themselves but need an extra boost for some example, that their condition is fine at first and then it deteriorates and they need a boost to go back on their self-help track. At least these are some areas. And patients maybe who don't have the technological skills, they might need a sort of coaching in the beginning and then they get on the digital path.
Okay, thanks. Anything else from you guys?
Yeah, my background lies in media marketing, digital media, and in service design. So I kind of look at this challenge through a lens of a service designer. And what I've learned in Carelia is that basically our customers who are in crisis are in a situation where they want to have the real life connection. And that's what they are really after. And it totally depends on the person, on her or his life situation, on how they want to be taken care of. But it varies, and there is, of course, place for both digital and both real life thing.
That's a good point. What about in...
Yeah, I think it's important to understand this is a multifaceted question. You have like more the objective view and then the subjective view. So the objective view is what does the science allow? Does the science allow to do this 100% digital, which is more the objective view? What does the clinical literature say about this chronic condition? The other part is what you touched upon. What does the patient want? What does the medical professional want? This is two very different questions, and you need to figure them out in isolation, basically, to make it work. And we do both. I mean, the science allows us to do everything digital, but in some cases, the patients want to meet their medical professionals. So then we do a semi-digital analog solution.
Okay, can you tell me a little bit about the customer feedback, what you guys get from kind of the digital parts of the solution? So what do the people really like about kind of digital therapy in your case?
I think you have much more of a continuous, treatment protocol. It's much easier to receive the activities you're supposed to do. The adherence is much higher. The barrier is much lower. It's much more frictionless. So I think we get a lot of great feedback on that. Like it's very easy to follow this treatment protocol. You don't have to you don't have to travel to the doctor's or the physical therapist's office. I think that is one very common feedback point of view that we get from our users, yeah.
Yeah, so kind of having a routine in terms of kind of getting yourself back to health. And
a chronic disease doesn't go away. It's often tied to lifestyle behavior. So I mean it's something that you need to have deeply integrated into your life. So if you could remove the friction of doing what you're supposed to do and not what you're not supposed to. So yeah, then that makes a lot of sense. Yeah.
Okay, good. So next, I think concrete examples, because sometimes, this sounds so theoretical when we, talk about these things. So kind of the lowest hanging fruits, the best examples you've seen on the market, based on, the customer cases that you see, how to have the biggest impact with these types of kind of concepts and solutions that we are driving. So share something kind of from the real world that, we all are longing to hear. Kristian.
Well, yeah. So as I mentioned, we're kind of like in the early days now with running a closed pilot. But some of the feedback, so like anecdotal that we've gotten so far, is that like people who would not have sought care previously have sort of like been very excited to now be able to do these types of, kind of access care through these types of solutions. So several people that have been kind of at our clinic, at our online clinic, and treated by us, have been giving us kind of this feedback that they really like would not have gone to the doctor to even talk about their depression, but they've kind of, it was so easy for them to access this online clinic that they actually then started, addressing the problem. So I think that's one example which is very concrete and very sort of like exciting.
That's pretty huge. So kind of accessibility, again, in a digital world is so easy. Okay, great point. Kaisla, what about you?
Well, coming from our psychologists, who are the professionals behind the web-based programs, who are the ones who follow, each of them have several customers, say, for example, 60 patients at the same time during their web-based program, and the psychologists follow what they're doing, comment when needed, and ask questions when needed. And their message has been that it's great that they can help so much more patients than they could if they were live, face-to-face. Because what they do in cognitive behavior therapy, you do a lot of concrete exercises, and you write exercises in your notebook, and all that takes time. And when you have automated all of that routine work, you can really, a lot of people can do the exercise at the same time, and then you give the personalized feedback to the ones who need it when they need it. So I really think what comes from professionals is that the feeling to be able to help a bigger group is great.
Okay, greater reach in addition to accessibility.
Absolutely, yeah.
Wonderful. Satu?
Yeah, we're also, as we work with the practitioners that are in our marketplace, it's really, like you described, offering tools to ease up their everyday is really important, and we are working on that very closely with our practitioners. And what we have learned from the client side is that the most important thing that has the effect on the treatment is that the chemistry between the practitioner and the customer is good. So if that works, the results are very good also.
Okay, that's so quality of interaction.
Exactly.
Okay.
Yeah, I think we're one of the very few global digital therapeutics companies that actually have published a lot of papers, peer-reviewed papers. We're kind of rigorous about, having third-party objectives, reviewing us. So we did on a study where we, looked at the equivalent of delivering our digital solution versus the face-to-face version. And then we could show that we delivered, the same clinical outcomes, but, to basically 70% less of the cost. So that is, very, very exciting. And also, people in the room are looking at or have founded a digital therapeutics company. I would say put a lot of effort into doing these RCTs into the clinical studies because they landed us, big deals with the insurance companies. Because if you could prove this type of efficacy, you are way, way ahead of a lot of other people and other startups. Because it's kind of rare, because it's, it's a lot of talk going on within digital health, but it's very, very, few that could actually show the efficacy, that it actually delivers something meaningful, so yeah.
Okay, so cost reduction and efficacy, okay.
Yeah, it's a combination of
Yeah,
both.
pretty powerful KPIs we have here, so if we kind of summarize the points from everyone, so that's really interesting. Okay, so then where do we go from here? Kind of what's your vision? What will happen during the next 5 years or 2 years or 3 years, how you want to frame it? Kind of how will the world change and what will we see more? What maybe we see less? So maybe coming then back from there.
I mean, the chronic conditions aren't going away and people, are getting older and older. I would say, I think you have like 15 chronic conditions that, burdens 80% of the global healthcare cost. And I think, most of these are, tied to lifestyle behavior and could be delivered through a digital intervention. You see some companies in the US like Omada Health doing it for type 2 diabetes prevention. You also have a lot of, exciting mental health digital therapeutics that are growing quite quickly. So I would say you're probably going to digitize a lot of these interventions. I think we're just very, very early in the curve. I think digital therapeutics is going to be quite big. I also see a lot of pharma companies being scared, like you don't have to take a pill, you could actually do this and you get, meaningful outcomes. So I think this is, very exciting, very, very early.
And very, very nice part of the market to be where we all are right now. Okay, Satu.
Yes, I think that all these digital services are definitely a very good direction where we are going. As stated, that it kind of makes it easier for people to get help, because there are a lot of problems, and the problems aren't really getting smaller, I would say. But what I see in our perspective is that the personal communications between professionals and customers, that's something that I would describe as the premium of the future. To have that personal time with the professional, having the full attention, I think that's really important too. And but I also see digital channels and accessibility really important. That's the basis for everything.
I see two very positive side effects coming from the change. Hopefully already in 5 years we'll see the group of patients who previously wouldn't have sought for help because of some sort of stigma that still exists for mental health issues. They, through all this, the positive media we have about these interventions, it'll be more of an everyday thing to do, and go practice, do something for yourself regarding your own mental health. And that's a positive thing, so that problems don't need to grow bigger. And another thing is, for another group of patients who feel very much, when they get a diagnosis, they feel that now they have the right to receive help. They come to a clinic or to meet any professional and say, now, here I am, help me please. And they're relaxed, and they think, they can now just wait for the help to come. And I believe this group hopefully will be activated more and more. You talked about behavioral activation and engagement and motivation. All of that will help a large group of people realize that the first thing is that they can do, and they should do something by themselves and for themselves. And that's a big thing. That's a big change if that happens.
Yeah, kind of good points there already. So kind of combining some of the stuff, I believe that coming from, that like some of the, the empowerment is gonna take place. So a lot of people are gonna start realizing that actually they have the power to change their own health, and they're not like victims of becoming, diagnosed with diabetes or whatever. There's like an exciting company called Ranta Health that from Sami Inkinen, some of you may know him, and they are now doing diabetes reversal. So they're reversing type 2 diabetes with like good clinical evidence already in the bag. So a lot of stuff that previously people didn't think was possible is becoming possible, and possible through your own actions. So I love that. That's like the coolest thing ever. But then the second kind of cool thing that I'm excited about is that there's going to be digiceutical companies. So now there's pharmaceutical companies, and then in the future there's going to be also digiceutical companies. And that's going to be companies like Jakob's company as an example. And that's cool, because then there's going to be alternatives, very effective alternatives where people can receive care, which is not necessarily pharmacological. I have nothing against pharmacological treatments, but for many people, it's kind of, there could be additional ways and, other ways also, either to complement pharmaceutical treatment or, replace in some parts.
I love the term digiceutical. Sounds fun. Do we have any questions actually from you guys in the audience? Because I do have one more, but if anyone has anything, we would have a few minutes with the panelists. We're in Finland. No questions from the audience. Okay. So we have. Lovely. Oh, just a comment. Okay, so did you guys all hear? So pharmaceutical companies should start to develop, how did this formulated?
Drugs that enhance the effect of digiceutical.
Yeah, exactly. Okay, add-ons, value-added services to digiceuticals. Oh, love the
Well,
idea.
it's kind of like quick comment. Actually, what's happening is already that like the effect of pharmaceuticals is being increased by these digiceuticals.
Reversed, rather, exactly.
Any thoughts on that one, by the way?
Yeah, no, I mean, on her question, you mean?
Yeah, yeah.
Yeah, no, I think it's more in the reverse. I mean, they have these, molecules, and then we are enhancing the molecules through, the digiceuticals. I would know if you prefer to call it that.
Okay, so my final question, any thoughts on the responsibility question? So, who pays the bills and, who should be on the driver's seat? So, who is kind of driving forward digiceuticals or paying for these solutions, and who should be kind of responsible, and any thoughts on kind of this matter? Like 1 minute.
Yeah, so we work a lot with the regulatory interoperability aspects. We choose to position ourselves as a medical technical device with CE certified, so we could both say that we are allowed to diagnose and treat the chronic decision online. Some companies choose to maybe take more the shortcuts to avoid the regulatory and these like who's paying, who's taking the bill and responsibility. We actually invested kind of heavily in this area. And we're also, in terms of taking the cost, we work a lot with reimbursement. So we have, we get, we get tax money, we get subventionized for our treatment in Sweden. We have most of the big insurance companies, their health plans reimbursing our treatment. You usually call it like a B2B to C model.
Yes, good model. Any other thoughts?
I think regarding resources such as time and effort, I think the customers or patients or citizens' role is really important. They have the possibility to engage in value co-creation. For a concrete example could be sort of creating video materials for people, of course, have panic disorders in shopping centers or buses and trams and wherever. There could be a sort of big pool of these videos that people anywhere have been taking, this 360 view, and they can share them, put on these special virtual reality glasses and experience those, and in a safe manner, step by step, do more and more difficult videos. And when you have a big enough pool, then it's beneficial to everyone. So just a small example, but I think not only the professionals and the one who pays, but also the end users can really contribute to this.
Yeah, I've heard this saying that the mind is the new body, and I think it's quite a nice thing to say, and I think individuals have a lot of power in making these health things visible and acceptable, and kind of we are all able to make a change in this culture.
Mind is the new body. Yeah. Gotta love that one. So, Kristian, if you don't have anything, then I would like to wrap up with that thought. Okay, thanks guys. Big hand.